Hey guys, welcome back to my channel, The ENT Resident. Today I'll be talking about the pharyngeal arches and its derivatives. This is a long question that you get in your anatomy final papers, the theory papers, and this is also a very common Viva question that can be asked to you like, what are the pharyngeal arches? What are pharyngeal clefts? What are pharyngeal pouches? And what are the derivatives of these things? So, today's discussion is about pharyngeal arches and its derivatives. So, around the third week of intrauterine life, the embryo is looking like this, straight, as you can see in the image over here. This is the neural tube. The blue structure that you see here is the neural tube. And this is the cranial end, and this is the caudal end. And around this third week, the embryo starts folding along two axes. One is the craniocaudal axis, which is this, and one is the lateral axis, which is this. So once this folding has happened around the third week, next what we see is in the fourth week of the intrauterine life, I'll first show you the structures here. This is the stomodium. This is the cardiac bulge. So what happens in the fourth week is the region between the stomodium and the cardiac bulge, which is this area starts to form the neck. And this elongation happens due to a series of bilateral mesodermal thickenings in the wall of the cranial-most part of the foregut, and these are known as the pharyngeal arches. So you see over here, these structures that you're seeing, these are the pharyngeal arches that develop due to elongation between the stomodium and the cardiac bulge. This is the stomodium, this is the cardiac bulge. This part undergoes elongation due to a series of bilateral mesodermal thickenings, and this forms the pharyngeal arch apparatus. Next, what happens is the neural crest cells, they go and interact with the lateral extensions of the pharyngeal endoderm, and they surround the 6 aortic arch arteries and initiate the pharyngeal arch development. So as a result of these neural crest cells, what happens is the mesodermal core of each pharyngeal arch is invaded by these neural crest cells. And the mesoderm and the neural crest cells will form different structures of the body. The mesoderm will form the muscle myoblasts, which will give rise to the different muscles of the body, different muscles of the head. And the neural crest cells will give rise to the skeletal and the connective tissue. Now, as these arches form, between two adjoining arches, endoderm extends outwards in the form of pharyngeal pouches. I have made a picture of the diagram of the pharyngeal arches. So first see over here. So these are the pharyngeal arches. There are 5 arches. So initially there are actually 6 arches and the 5th arch gets obliterated in humans, and as a result we are left behind with 5 arches. And you can see these arches, these are actually mesodermal. So we have to remember this is mesoderm. Whereas now you'll see on the inner side of the arches, these areas, there are some evaginations of the endoderm. This is the endodermal lining. These evaginations forms what is known as the pharyngeal pouch. And on the external surface of these pharyngeal arch is the lining of the ectoderm. And these ectoderm invaginates inside, that is move inside and lead to formation of the pharyngeal clefts. So if we had to remember this very easily, from outside inwards, there is the pharyngeal cleft, then is the pharyngeal arch, and then is the pharyngeal pouch. So from outside inwards also, if you have to remember, it's always ectoderm, mesoderm, and endoderm. So that's how you remember from outside inwards. Cleft, arch, pouch. Cleft is ectoderm, arch is mesoderm, and pouch is endoderm. So, between these adjoining arches, we have seen the pharyngeal pouches on the inner aspect and the ectodermal clefts on the outer aspect. And as I've already said, there are initially 6 arches. The fifth arch gets obliterated soon after all branchial arches become apparent. And all these structures that you have seen, the pharyngeal cleft, the pharyngeal arch, and the pharyngeal pouch, they all together form the pharyngeal apparatus. And each arch over here, you can see in the image that each arch has these tiny dots inside. Each arch, basically, the blue dot is the cartilage, the red dot is the artery, and the green dot is the cranial nerve. So each mesodermal arch or the pharyngeal arch contains its own cranial nerve, artery, and cartilage, and these cartilage will develop into different structures of the head and neck. And why do you think this is also known as these pharyngeal arches are also known as the branchial arches? That's because the arches, clefts, and pouches they kind of give a appearance of a series of slit-like grooves. If you have seen how the gills of a fish look like, it kind of has a similarity to that structure. Hence, the term branchial was given to this. The term branchial is derived from the Greek word for gills. That is why this is known as the branchial apparatus. So now we know the ectoderm forms the pharyngeal cleft, which is the outermost structure. The middle structure is the pharyngeal arch, which is formed from mesoderm, and the mesoderm has itself the cranial nerve, artery, and the cartilage. And the innermost lining is the endoderm, which forms the pharyngeal pouch. Now, next we'll be discussing about the structures which are formed in the mesoderm of each arch. If we had to zoom in, this is a zoomed in version of one pharyngeal arch. You can see, I have just mentioned, the outside lining. The outside lining here, this is the ectoderm. This whole middle area is the mesoderm. And this inner lining is the endoderm. And within this mesoderm, you can see there's a cartilage, there's an aortic arch, there's muscle. This pink structure over here is the muscle, and there's a nerve, cranial nerve of each arch, which supplies the muscle. So these are the structures. I'll discuss a little bit more about the structures within the mesoderm. So first, the skeletal element, as you have just seen, it is the cartilaginous element, and this element may remain cartilaginous, or they may develop into a bone, or they may completely disappear. Next, the second part is the striated muscle. The striated muscle, which is formed within each arch, it is supplied by the nerve of that particular arch. Later, this muscle may or may not retain its attachment to the skeletal element of the arch. Sometimes the muscle may even subdivide to form a number of distinct muscles, which may migrate away from the pharyngeal region. But even if that happens, the nerve supply will still remain the same, which is the nerve supply of that corresponding arch. Third were the arteries of the pharyngeal arch. So, as I've said, each pharyngeal arch will have its own artery. And lastly is the nerves of pharyngeal arch. Now, each arch is supplied by a cranial nerve that supplies the skeletal muscle. And the sensory branch of that nerve supplies the overlying ectoderm and endoderm, which forms the skin and the mucous membrane. The ectoderm forms the skin and the endoderm forms the mucous membrane. Morphologically, each pharyngeal arch is supplied by two nerves. One is a post-traumatic nerve and the second is a pre-traumatic nerve. Now, what is a post-traumatic nerve? Post-traumatic nerve is the nerve that runs along the cranial border of the arch, whereas pre-traumatic nerve is the nerve that runs along the caudal border of that arch. So I've made an image over here. This one is the first arch, this is the second arch, and this is the third arch. And you can see over here, the nerve that is running along the cranial border, this is a post-traumatic nerve of the first arch, and this is the mandibular nerve. Whereas the nerve which is running along the caudal border here along the first arch is the cauda tympani nerve. The cauda tympani is the pre-traumatic nerve of the first arch. This cauda tympani is a branch of facial nerve. Facial nerve is again the nerve of the second arch. So you can see here that the facial nerve is the post-traumatic nerve of the second arch. Then again, if you look at the caudal border of the second arch, you can see another nerve, which is the tympanic branch of the glossopharyngeal nerve. The tympanic branch forms a pre-traumatic nerve of the second arch. And you can see over here, the third arch has one post-traumatic nerve only. There is no pre-traumatic nerve, which is the glossopharyngeal nerve. So usually when we are asked about what is the nerve of the pharyngeal arch, the usual answer we give is the post-traumatic nerve. But if your examiner asks you if is there a special scenario in any case, you can say that in case of the first and the second arch, there's also a pre-traumatic nerve in addition. And the pre-traumatic nerve for the first arch is the chorda tympani, and the pre-traumatic nerve of the second arch is the tympanic branch of glossopharyngeal nerve. So this is all about the structures that you form in the mesoderm: the cartilage, muscle, nerve, and artery. Now, what we'll discuss is how each of the five arches that we know leads to formation. We'll kind of study a table which will tell you how all of these arches has their own nerves, their own arteries, and what do their skeletal element forms and what muscles do they lead to formation of. So let's discuss the derivatives of the pharyngeal arches. First, we'll talk about the first arch. The first arch is also known as the mandibular arch. And the mandibular arch, the first we'll know about the nerve, artery, cartilage, and muscle. The mandibular nerve is the nerve of the first arch. As I've just said, it is a post traumatic nerve. The artery of first arch is the maxillary artery, and the cartilage is the Meckel's cartilage. And this Meckel's cartilage leads to the formation of maxilla, malleus, incus, anterior ligament of malleus, and spinomandibular ligament. And the muscles formed by the first arch are mylohyoid, anterior belly of digastric, tensor tympani, tensor veli palatini, and the muscles of mastication. There are four muscles of mastication: the masseter, temporalis, medial, and lateral pterygoid. If you see in how I have written, a lot of the structures over here has the letter M in it. So that is maybe somehow that you can remember majority of it, although not all of the structures conform to this. So you can see the first arch is the mandibular arch. It is the nerve is the mandibular nerve, artery is maxillary artery, cartilage is Meckel's cartilage, which forms the maxilla, malleus, incus, anterior ligament of malleus, and spinomandibular ligament. And the muscles are mylohyoid. Anterior belly of digastric does not have M in it, so it's just something you have to remember. Tensor tympani, tensor veli palatini, and the muscles of mastication. Next, coming to the second arch. The second arch is also known as the hyoid arch, and the nerve of the second arch is the facial nerve. The artery of the second arch is the stapedial artery and the hyoid artery. And the cartilage is known as the Ricard's cartilage. This cartilage leads to the formation of four structures: the lesser cornu and the upper part of the body of hyoid, the stapes superstructure, the styloid process, and the stylohyoid ligament. And the muscles formed by the second arch are the muscles of facial expression, stapedius, stylohyoid, and posterior belly of digastric. In this, you must have seen that I have highlighted the letter S. So you can remember the second arch with the letter S, as most of the structures will have it in it. You can see the nerve has facial nerve, although the spelling of facial is not and does not include S, but the pronunciation kind of may include. So you can just remember it like that: the facial nerve, the stapedial artery, the cartilage, the lesser cornu, you just have to remember that. The stapes superstructure, styloid process, and stylohyoid ligament. Muscles of facial expression, stapedius, stylohyoid, and posterior belly of digastric. Next, we come to the third pharyngeal arch. The nerve of the third pharyngeal arch is the glossopharyngeal nerve. And the arteries are the common carotid artery and the internal carotid artery. The cartilage forms the greater cornu and the lower part of the body of the hyoid bone. And the only muscle that is formed from the third arch is the stylopharyngeus muscle. You have seen that I have highlighted the letter P over here. The glossopharyngeal nerve, where there is a P, and the stylopharyngeus muscle. Next, we come on to the fourth arch. The fourth arch nerve supply is the superior laryngeal nerve. The fourth and the sixth nerve both get its nerve supply from the vagus nerve, but they have different branches supplying it. The fourth arch has the superior laryngeal nerve as its nerve supply. The arteries are the aortic arch on the left side and the subclavian artery on the right side. The skeletal elements formed here are the thyroid cartilage and the cuneiform cartilages. And the muscles are the pharyngeal constrictors, the cricothyroid muscle, levator velli palatini, palatoglossus, and palatopharyngeus. You can see the muscles have a lot of P in them. You can remember that muscles of the pharynx are formed by the fourth arch, and one muscle of the larynx, which is the cricothyroid muscle. All the other muscles of larynx are formed by the sixth arch. Next, last of all, coming to the sixth arch gets its nerve supply from the recurrent laryngeal nerve. The arteries are ductus arteriosus on the left side and pulmonary artery on the right side. And the cartilaginous elements are the cricoid cartilage, arytenoid cartilage, and corniculate cartilage. And muscles, as I've just mentioned, all the intrinsic muscles of the larynx except for cricothyroid. So the fourth and sixth arch kind of together they form all the structures of the pharynx and the larynx. Fourth one is superior laryngeal nerve, and sixth is recurrent laryngeal nerve. So this table is something that you have to completely mug up and remember, and it is very important in your theory exams. You have to reproduce this table exactly like this. So these are the pharyngeal arch derivatives. And I was mentioning a small mnemonic to remember this. Also, it is not completely applicable to the whole thing. Uh, you can remember this by madly studying, plan vacation. The M first arch had most of its structure with the letter M, as you can see. The second arch had most of its structures with the letter S. Third arch had P in it, and the fourth and the sixth arch has V in it. This is not a very good mnemonic to remember, but maybe like 80% of the structures could be remembered with this mnemonic. Next, we discuss about the fate of the pharyngeal pouches and the pharyngeal clefts. The pharyngeal pouches are the endodermal evaginations into the pharyngeal arches. So there are four pharyngeal pouches. I've mentioned it to you. There are five pharyngeal arch. I'll show you the picture again. As you can see over here, there are five pharyngeal arches. So as a result of the five pharyngeal arches, there are four pharyngeal pouches on the inner aspect and four pharyngeal clefts on the outer aspect. So now we'll discuss about what are the fates of the pharyngeal pouches. The first pharyngeal pouch, it elongates to form a diverticulum called the tubotympanic recess. And this recess, tubotympanic recess, it divides into two parts, the distal part and the proximal part. The proximal part kind of remains tubular and it forms the eustachian tube, whereas the distal part it expands to form the middle ear cavity, mastoid antrum, and the medial surface of the tympanic membrane. Next, coming to the second pharyngeal pouch. This has ventral part and a dorsal part. The dorsal part kind of leads to the formation of the tubotympanic recess with the first pharyngeal pouch, and the ventral part it forms the palatine tonsil. And this palatine tonsil, in this formation, first it forms the solid buds, and the central core of these buds then break down to form tonsillar crypts. And part of this pouch may remain as the intratonsillar cleft. Next is the third pharyngeal pouch. Again, it is divided into two parts. The ventral tubular part leads to formation of the thymus, whereas the dorsal bulbar part leads to formation of inferior parathyroid. You may get confused that why is inferior parathyroid getting formed first, even though the superior parathyroid is located above the inferior parathyroid. Here you have to remember that inferior parathyroid is also known as parathyroid 3 because it takes origin from the third pharyngeal pouch. And after its development has done, then there is a migration of the parathyroid to its location. Hence, the name then later comes as superior parathyroid for the parathyroid 4 and the inferior parathyroid for parathyroid 3. Last is the fourth pharyngeal pouch, which again forms two parts. The ventral part forms the ultimobranchial body and leads to formation of the parafollicular C cells of thyroid, whereas the dorsal bulbar part forms the superior parathyroid, which is also known as the parathyroid 4. So this is all about the fate of the endodermal or the pharyngeal pouches. Next, we'll talk about the pharyngeal clefts, which is the last bit. So there are, I have told you that initially there are 4 pharyngeal clefts, but what happens is the second arch grows faster than the succeeding arches and it starts overhanging it. You can see in the image over here, the second arch over here is kind of starts overgrowing than the succeeding arches, and it starts to overhang it, and as a result of which that leads to the obliteration of the second, third and the fourth clefts. And the space that you see in between the overhanging second arch and the third, fourth, and the sixth arch is known as the cervical sinus. So you can see over here, this region over here leads to the formation of the cervical sinus in the image over here. And this cervical sinus is lined by ectoderm, and normally this ends up getting obliterated. So there is only first pharyngeal cleft that you need to know about. The first pharyngeal cleft gives rise to the epithelial lining of the external auditory meatus and the outer layer of the tympanic membrane. The inner layer of the tympanic membrane is formed by the pharyngeal pouch, with the first pharyngeal pouch. So this is all about the pharyngeal arches and its derivatives, the things that you need to remember, what are the pharyngeal pouches and what are the derivatives of pharyngeal clefts. And that whole table that I have just showed you, it says which is the nerve, artery, the cartilage and the muscles of each of the arches. If there's any other thing you want to know about pharyngeal arches, please comment in the comment section and I'll get back to you on it. Thank you. See you in my next video.